Just circling back to Governor Cuomo, the Washington Post reported on Sunday that a top Cuomo advisor, who also happens to be New York's vaccine czar, called county officials to gauge their loyalty to Cuomo amid his sexual harassment investigation. I wanted to see if the president is concerned that vaccine distribution in New York has become politicized, and is the administration taking any steps to make sure that political favoritism is not tainting access to vaccine for New Yorkers?
Mm-hmm. Well, first, let me say we all read those stories. One was in your outlet. There were a number of other stories out there, and certainly we found them concerning about this inappropriate reported behavior. There are a number of checks in the system, I will say. The CDC has the ability to track and monitor distribution. And we've talked about this a little bit before as it relates to equitable distribution of vaccine supply. And so every vaccine box is tracked and we know where it's going, and the CDC can track that and monitor. And if there are, we work to ensure that it is equitably distributed and that there are not steps that are taken that are concerning. The other piece is that we work with local health officials across the state, right? We work with officials, who are overseeing distribution in all of the different cities, localities, to ensure that they are getting what they need, that there are no breaks in the system, and we are engaged across the board, especially in a state like New York, and we certainly track any concerns that come up. There we were concerned, of course, about the reports of this inappropriate behavior, but we also have a number of steps that are already in the system to ensure that the people of New York, the people of any state, are getting the vaccines distributed fairly and equitably.
So given those reports over the weekend, did you take any extra steps to take another look at, especially at New York? Because the allegation is quite concerning, I would think, for not only on New Yorkers, but all Americans.
Of course, we are constantly monitoring. I've not been made aware of any incidents that have been raised in relation to this report. There are regular reports out of states that we take a look at, even before this report. But if there is, I can see with our team if there's anything new as it relates to this report from this weekend.
And then also, on Cuomo, just following up from an earlier question, it's our understanding that Governor Cuomo he doesn't merely participate in these calls, these COVID calls, but he is in fact leads them and is a big player in terms of organizing them. And so we're curious if the president has any concerns with that, with his sort of level of leadership over this critical piece in, the COVID response.
Well, it would be up to the NGA to determine if they were to make a change on that front. It's also up to the legislature and others in New York to determine if he still has the confidence of the people in the state. But our focus from here, from the federal government, is of course supporting that independent investigation, which we adamantly do, but also working with governors across the country, with the NGA, with the DGA, with others, to address issues that come up, or hear from them and listen to them and work with them on COVID, on addressing COVID, getting the pandemic under control, et cetera. And we will continue to work with a range of governors across the country.
Under the Trump administration, it was not set up this way. My understanding is under the Trump administration, Vice President Pence was doing these weekly calls. And this has been a shift to go from Pence to somebody like Governor Cuomo at this point. So I'm wondering if perhaps the White House wants to shift it back towards the White House or away from the NGA, which happens to be led by a governor who has a lot of things going on in the state at the moment.
Well, one of the reasons that it's been set up to engage directly with governors is that there were operational aspects of the way the last administration approached COVID and approached COVID, the distribution of vaccines, or approached planning and engagement with governors that wasn't working. They didn't feel they had the information they needed. They didn't know when they were getting vaccine supply. And our effort was to work much more directly in a range of means, in a range of ways, up and down the ranks in these states to ensure that we were addressing the local needs as they came up. So I'm not aware of any plan to shift that approach.
Comfortable with Cuomo essentially leading these weekly calls?
Again, this is up to, I think he's in that position because he is head of the NGA, and it's up to the NGA to determine if that's where they want to see things moving forward.
Just quickly on immigration.